patient here is doing biomagnetic therapy. We're going to do muscle testing first just to see what her organ weaknesses are, and then we'll get started. So go ahead and put your arm up. So match my pressure. All right, so stuck in fight or flight, has some sinus issues, a little bit of a thyroid weakness, kidney deficiency, transverse colon, and a little bit of stomach inflammation. She's also on her cycle, which that shouldn't usually come up, but she does have menstrual issues. So we're going to get to the bottom of that. So she has had mono, which that also, since her thyroid came up, our T cells, our thymus, also can come up because they are within the throat area. So since she's had mono, her immune system is low. There has been a new study that says that if you've had mono, then you are at risk of getting lupus. So today we're gonna clear that out with the magnets, because we work with the Guillain-Barré virus. So we put the magnets on the location and it will go ahead and clear that out. There had been a study, I'm gonna post that up here, and then also in the show notes. So, all right, now we are scanning the body, and then I'll be muscle testing her legs. So first things first, we're gonna start at the top of the head. In biomagnetic therapy, we have 305 meridian points, but we have 250 points that we have to do in biomagnetic therapy. So we'll be using magnets that are over 1,000 Gauss. These are not magnets that actually you can get anywhere. These are medical magnets, and you have to be a licensed practitioner to use them. So I go down on my clipboard. So we're starting from the top of the head to all the way to the feet. And we have the negative, and then we have the positive. So when we take a negative and positive charge and we're placing on the meridian points, then there becomes an electromagnetic field that takes place, just like if you put a piece of metal between a magnet. Since we are positive beings, we work on north and south nodes. So just like the earth has a north and south node, so does our bodies. When we have negatively charged, since we are hosts, we are positively charged. The hosts that are living inside us are fungus, bacteria, parasites, viruses, that kind of a thing. And when we place the magnets on it, it creates electromagnetic field, and then it's an encasing where then it explodes, and then it provides you an alkalinity in your blood. And that's how Dr. Goes, he's the doctor who invented and has been doing this for a long time. So we're gonna get started.